So my name is Reena Rupani. I'm your host for today. And those of you who are new to SHARAN, SHARAN is a social enterprise started by Dr. Nandita Shah in 2005. It's an acronym. It stands for Sanctuary for Health and Reconnection to Animals and Nature. And what's special about Dr. Shah is that she does not prescribe any medicines, but food as medicine, because she herself healed her very rare autoimmune disorders through a change of diet. She was a homeopath before, but after she understood that diet plays such a huge role, she has even stopped prescribing homeopathy. Um, she's also the recipient of the Nari Shakti Puraskar, which is the highest award for civilian women in our country, because thousands and thousands of people have been able to reverse or prevent lifestyle diseases simply through a change of diet. She's also the author of the bestseller, Reversing Diabetes in 21 Days. So all lifestyle diseases, chronic and otherwise, can actually be reversed or prevented simply by a change of diet. And hypertension is something which is very, very common. They say 40 के बाद तो सबको tablet लेना पड़ता है. We just consider it as normal, but disease is not normal. Health, good health is normal. And that's what SHARAN is trying to do, build a culture of health. So without much ado, please allow me to have Dr. Nandita take over and enlighten us today as to how we can actually reverse or prevent hypertension.
So as I said, May 17th is World Hypertension Day. And a few facts before we start. The majority of people with hypertension are not even aware that they have it. In fact, many people have a blood pressure machine in their home, but they forget to check their blood pressure. So please, if you're one of those, check your blood pressure at least once a month, even if it's fine. And if it's high, then I would suggest checking it regularly. The diagnosis of high blood pressure of more than blood pressure of more than 140 by 90 on 2 consecutive days signifies that you have high blood pressure and that something should be done. And today we're going to talk about what you can do to actually get rid of all this, even without medicines. Young people can have high blood pressure as well. And high blood pressure can lead to so many other diseases like erectile dysfunction, chronic coronary artery disease, stroke, chronic kidney disease, and even dementia. In fact, Alzheimer's can be also a result of high blood pressure. So, and 1.5 billion adults will be hypertensive by 2025. Isn't that a lot? We're very close to that. Out of 8 billion, 1.5 billion, that's a lot. Okay, so before we just go on, I want to introduce you. I'm going to stop my share. And I want to introduce you to Madhura. Many of you may already know her. The reason I'm bringing Madhura in right in the beginning is that Madhura suffered from hypertension and stroke at a very young age. That means even if you all are listening, it's still worth checking your younger, like young adults in your house, 20, 25, in case they have high blood pressure.
Thank you, doctor. Thank you for the introduction. Welcome, everybody. So I was suffering from a lot of, lifestyle diseases way early in life. I went through a very hormonal imbalance. I started my menstrual cycle way early. And because of that, at the age of 8, actually, and because of that, I suffered a lot of anxiety and depression. And, because of, I'm from a non-veg eating family, and the medication was making me eat a lot, and I was putting on a lot of weight. But the biggest blow was when at the age of 25, I woke up in the morning one day and I had suffered a stroke. So one eye opened and one eye didn't open, and I was rushed to the hospital where my blood pressure was 220 by 160. Immediately, I was put on a lot of medications, like I was given steroids, I was given antihypertensives, I was given blood thinners, and a lot many other medications as well. By the early 30s, my life, like the health was a mess. And, I was overweight, obese, always tired, lot of fatigue, and depression was at its peak with so many medications going on. The turning point was an emergency gallbladder removal surgery where, they had rushed me to the hospital to remove my gallbladder because of stones. And that's when my husband put a foot down and said, no, we can't be so unhealthy. He was also pre-diabetic, and his cholesterol levels were very high. So he researched and got the whole food plant-based diet home. And earlier, the nutritionist in me really fought tooth and nail. Like, I didn't want to give up my chicken, eggs, fish, and all of that. But, I was just a new mother that time, and I didn't want to cook 2, 3 meals in the US. There's no help. So I thought, let me give it a chance. And I just started doing it with him. And I started feeling really good. I lost about 4 kgs of weight in the first couple of weeks itself, and never lost weight, till then. So it started feeling better. The medication started coming down, and I was myself again. So even with 2 small kids and no help, I was doing really well in life. And even though, like the stroke was not a very good thing that happened to me, I always call it a very fortunate incident because I found the purpose of my life there. And now I'm working in this field. I'm with Sharan. I'm doing a lot of programs, consultations, awareness, and I feel I have, this is me and this is it. So I really ask you people, urge you people to take the health in your hands, follow the Sharan lifestyle and get well. Thank you, doctor. Over to you.
Thank you, Madhura, for sharing this story with us. And imagine that Madhura was just 25 when she got a stroke. And actually, her mother was the dean of a medical college. So she was given the best medical treatment. However, changing her diet not only helped her get well, lose weight, get free of depression, etc. Today, so many people suffer, so many young girls have premature puberty, right? So many people are overweight. And so many people have high blood pressure. And, Madhura had such a high blood pressure and yet was totally unaware till she got the stroke. So we saw these. Now, the current approaches to the problem, when we go to the doctor, what does the doctor tell us to do? They say limit red meat and fried foods. They say reduce the salt intake, take antihypertensives. They even add on a few more medicines like blood thinners and cholesterol lowering drugs. But, all these things never cure. These are things we have to do lifelong. And yet, over a period of time, medicines increase. Now, here we are talking about reversing. Reversing means going back to where you were. What Madhura has done today, her blood pressure is totally normal. Her weight is good. And she doesn't suffer from depression anymore. And no hypertension, and definitely no symptoms of stroke. So reversing means going back to where you were, normal blood pressure, normal blood reports, everything normal again. And if you want to reverse any disease, we know that when we follow doctor's advice, we control diseases. If you want to reverse diseases, then we don't have to handle just symptoms, which is what the doctor does. Blood pressure high, give medicine to lower. Cholesterol high, give medicine to lower. Or blood too thick, give a blood thinner. No. What we do is we understand what is the cause of high blood pressure. Why did Madhura get high blood pressure in the first place? And if we understand the cause and remove the cause, hypertension has to go away. The only reason that hypertension is there right now is because we are still living with the causes of the disease. So let's look at what are the causes. But before we get there, what is hypertension? Let me explain this. High blood pressure is, or rather blood pressure, is the pressure that our heart exerts to push the blood everywhere in the body. So the heart is a very vital organ that's inside the thoracic cavity. That means it's protected by the rib cage so that it can work for us lifelong. And the heart has to pump blood to every little cell in the body. We have so many billions of cells in our body that we have a whole highway of arteries back against each other. They would go around the equator of the earth 2.5 times. They would go around the equator 2.5 times. Imagine, this gives you an idea of how thin and actually fragile they are, right? And that's because they have to reach every single cell of our body, because any cell without food and blood supply and oxygen will die. So the blood vessels are supplying, or the blood is supplying all of this. Now, over a period of time, with our regular way of eating that we are doing in our culture today, over a period of time, we are slowly blocking the arteries. Imagine these arteries are so tiny that this is actually a hugely enlarged image of the artery. And here you can see that from the time we are born, right on the left side, up to the right side, where as we grow older, the arteries are getting more and more blocked, but they are not supposed to. This is because of our culture of disease today. So what happens is, when the blood becomes thick, it flows through the artery walls. And I'm just going to explain this. Imagine if this was a blood vessel and there was water flowing through it. The water flows easily. But if I put 1 tablespoon of oil in it, all the water will become viscid and it won't flow. That's exactly what happens in our blood vessels after we eat the kind of meals we eat today, like fried foods or fatty foods or desserts. So the blood becomes thick. It injures the artery walls, as you can see in the figure 2 on the right, like upper right quadrant. And then if you go to the lower left quadrant, you see that over a period of time, the arteries become more and more blocked, because these tears in the artery walls are bandaged with cholesterol. So cholesterol buildup occurs in the arteries. And you know, the cholesterol builds up in the arteries, but it may not be flowing in the bloodstream. So you could even have normal cholesterol levels and arteries blocked. Now, all that is usually okay unless some plaque, some deposit from some bigger artery flows through and goes through a narrower artery and blocks it up, like in the 4th or the lower right diagram, where you can see that the artery is completely blocked. Now, this means whatever area it's supplying doesn't get oxygen supply. Now, over a period of time, if our arteries are narrowing, our body is always working to heal, and so it produces a collateral circulation. It produces its own bypass, so that if you see the diagram on the right, the artery is completely blocked, but the person will not feel anything because there's a perfect bypass. This can happen only if our arteries are getting blocked over a period of time. Here is the same diagram, but if, like on the left side, an artery gets blocked suddenly as compared to on the right side, or diagram B, where the artery has been blocked over a period of time and the collateral circulation has occurred. If the artery gets blocked suddenly because plaque breaks off from bigger artery and goes into the smaller, more fragile arteries of the heart or the brain, then we end up with a heart attack or stroke, right? So here you see a normal artery is completely open, but over a period of time, there's plaque buildup and narrowing of the arteries. What are the symptoms of hypertension? You know, sometimes you don't even have any symptoms, like Madhura didn't have any symptoms, or rather she had a bunch of symptoms that didn't look like hypertension. She had the depression and the premature puberty and the, all her other little problems. But otherwise, symptoms of hypertension would be chronic headaches that last for days, dizziness and vertigo, blurry vision, drowsiness and fatigue, and Madhura told you about that, and impotency or erectile dysfunction, and shortness of breath, heart palpitations, flushing of the face, nosebleeds, frequently urging to urinate, and ringing in the ears. All of these are symptoms or possible symptoms of hypertension. So can you see why we should regularly check our blood pressure and look after our health all the time? And of course, nausea may also be a symptom. Now, blocked arteries anywhere means you're not getting enough oxygen. And that the body tries to let us know through symptoms. For example, if blocked arteries to the heart, you will suffer from pain, angina. Or if arteries are blocked towards the brain, then we get those headaches. Remember, headache was one of the symptoms of high blood pressure. And even if arteries are blocked in our joints or in our back or in organs, we get symptoms like back pain or joint pain, or even, one of the causes of cancer is blocked arteries to the organs. So same with the brain. If an artery is blocked in the brain, we get stroke. So stroke, coronary artery disease, and hypertension are all one and the same phenomena expressing in different areas of the body. Now, what are the causes of hypertension and heart disease? Number one cause is fat. Remember, I showed you that bottle and I showed you that if, there's fat going into the bloodstream, it's thickening the blood. The thicker blood injures the artery walls, and the artery walls are bandaged with cholesterol. Main cause of heart disease is fat. And that's why doctors tell us that you should cut down the fried foods and cut down the meat. Lack of fiber. Fiber actually holds on to fat. So let me explain both of these right now. Where is all the fat? The fat is in the oil, ghee, butter, which is why we teach people how to cook totally delicious food without any oil or ghee or butter. Then fat is in all animal products. Like if you boil milk, you get fat on top. If you boil meat, you get fat on top. If you boil chicken, you get fat on top. If you boil fish, you get fat on top. All animal products are full of fat. Now, so are peanuts, sesame, and coconut. But look at this. If you boil peanuts, you don't get fat on top. Try it if you haven't tried it yet. Or if you boil sesame seeds, you don't get fat on top. If you take a piece of coconut and boil it, you will not get fat on top. Why? Because of the fiber. The fiber holds on to fat. Now, if we want to get rid of the fat in our arteries, then we have to increase the fiber in our food. And fiber only comes from plants. There's no fiber in animal products. So what do we have to do? We have to eat more plants. But we should also eat plants with the fiber. For example, oil comes from plants, but the fiber is removed. Fruit juice comes from plants, but the fiber is removed. we need to have whole foods so that all the fiber is there. That means no peeling vegetables and fruits, and no refined foods like oil, sugar, white rice, and white flour. And then meat contains free radicals. Meat and dairy as well contain free radicals that cause an inflammatory reaction in the artery. And whenever the arteries, become inflamed, they become narrower as well. So we want to counteract this with plant foods which contain antioxidants. Antioxidants work against free radicals. And then we all know that stress causes high blood pressure. Like when we're stressed, if we check our blood pressure, it's always high. If we've been running around madly, blood pressure can be high. Lack of exercise can also lead to high blood pressure. Lack of rest can lead to high blood pressure. Lack of vitamin B12, very important. Our body has two important vitamins that are required, but may not always come through a healthy diet and lifestyle. They are vitamin B12 and vitamin D. And lack of vitamin B12 can cause heart disease and hypertension. And tea, coffee, colas, alcohol, and smoking, all of these raise the blood pressure and can cause heart disease. That's why it's so important that we get rid of all of these as soon as possible. And if you can't get rid of everything overnight and you don't have heart disease or hypertension, try to get rid of them one by one. Oh, and I missed this, excess salt as well. Excess salt also raises blood pressure. So the current approaches that we already saw is that doctors say, eat less red meat and fried foods. No. If we have this problem or really want to prevent it, we have to become serious. We have to avoid all fats and fried foods and avoid fats from animal products as well, free fat. We should reduce salt intake. And when you eat the snacks that are readily available in the market, those snacks are full of salt because salt is addictive. We should just have normal salt all the time, never too much salt. And then doctors give antihypertensive. That means they give medicines that dilate the arteries, that make the arteries slightly bigger. Because, the arteries are elastic and they can constrict when you're stressed or they can dilate when you're relaxed. So antihypertensive can help dilate the arteries so that the blood pressure falls, but only temporarily as long as that medicine is working. And then blood thinners. Why do they give blood thinners? Because the blood has become thick through fat. Now, what should we do instead? We should make sure that we avoid antihypertensives by avoiding blocking our arteries by stopping eating the fat. And we should make sure that our blood is always thin so that the thin blood can dissolve the fat that has already accumulated in the arteries by just, dissolving it and taking it out. And so how do we do that? With having lots of fiber so that the blood always remains thin. And then doctors give cholesterol lowering drugs. But what are we going to do? We are going to avoid all the foods which raise cholesterol. And only animals produce cholesterol. We are animals, so we have a lot of cholesterol, but all the excess cholesterol comes to us through animal products in our diet. If we just cut out all the animal products, that means meat, fish, chicken, eggs, milk, and all forms of dairy. And when I say dairy, I mean milk, cheese, buttercream, paneer, ice cream, curds, buttermilk. And this sounds daunting. But I just want to tell you that today there are so many alternatives that it's so easy to do that, why don't we do it and get well, right? And interventions, like bypass surgery and angioplasty. And that, I think, is a very extreme step. Some people think that changing your diet is extreme and everything in moderation is fine, but then they get sick. But I think that resorting to interventions is extreme because our heart is protected by the thoracic cage. And if we have to cut open the sternum and go inside to the heart, that is really extreme and can be life-threatening as well. And I know people who went for angioplasty or bypass surgery and died on the table or soon after. Why are we resorting to this when we can just change our diet and be healthy and happy and well? So we looked at foods rich in fats, are all animal products, as well as refined plant fats, that means oils. Now, I do want to share that, we are interested in reducing medicines. There are medicines that we're taking that can actually raise high blood pressure. Like, here's a whole list of them, and I'm not going to read them all out, but you can take a photograph if you like. But common ones, alcohol and antidepressants. I've seen people on antidepressants where they had both diabetes and high blood pressure and were overweight, largely because of the antidepressants. And caffeine. And caffeine is not just found in medicines, but it's also found in coffee and tea and drinks like Coca-Cola and Red Bull. And then corticosteroids. Steroids are used for so many diseases. And erythropoietin, which is commonly used, especially in kidney disease, when someone has anemia, and estrogens or birth control pills. They're in birth control pills. They're also they also may be included in medicines for fertility or, for any other menstrual problems and so on. Even some asthma medicines can cause this. Migraine medicines can cause high blood pressure. And so it's so important that instead of treating different diseases one by one, we start treating the patient as a whole so that all the diseases improve. And this can be done by eating foods that nature or God meant us to consume. Like, for example, nobody's mouth waters when they see a chicken or a goat or a cow walk by. Now, if you see animal foods on the left-hand side and plant foods on the right-hand side, you can see that all animal foods are full of fat or have a high percentage of fat and cholesterol. But plant foods have fat. They have a little fat, of course, and no cholesterol. So people say, where will I get my fat if I only eat from plants? Even oranges and apples contain some fat. Nature is so wise that we'll get everything we need if we eat only plants. But even milk contains a lot of fat. 49% of its calories come from fat. Now, if I just go back to the earlier slide, percentage of calories in beef and chicken and eggs and fish, well, not fish, certain fish, is less than milk. So the amount of fat in milk is really high, and many of us have concentrated forms of milk. That means paneer and cheese. 1 ounce of paneer is 1 ounce of paneer is 12 ounces of milk. 1 ounce of cheese is 16 ounces of milk. And sometimes we don't limit ourselves to 1 ounce, do we? So we are consuming a lot of fat just through milk. And I won't even talk about cream. Now, we must supplement vitamin B12. This should be supplemented, not cyanocobalamin. Please look at your vitamin supplement if you're already taking it. And it should not be more than 500 micrograms per day. It can be less, not more. Our levels in the blood should be around 400 pg per ml. Normal levels are 211 to 911. We want to have it somewhere in the middle. 400 pg per ml is what we should aim for. So in summary, what should we do? We should change our diet, avoid tea, coffee, colas. Make sure that we do some exercise every single day. And this can be done very easily by climbing every flight of stairs, at least partially. When we see them, walk a little more, do our own housework a bit, so that, and then of course, if we can do actual exercise, like have an exercise routine, that's even better, right? And then rest at the right time. I do want to say that rest and exercise are equally important. Waking up with that alarm is very stressful. We do not need to increase our stress levels. So how do you avoid waking up with the alarm? By going to sleep early. Right. And so we have to make sure that we stop doing all our digital work, mobile phones and computers and all a little earlier than we have been doing. Go to bed, have a nice restful sleep so that your body clock wakes you up on time. Supplement with vitamin B12 and minimize stress. Okay, before I go on, and I have a few more things to say, we are going to look at meal plans and what you can read to learn more and how we can help you. But before we go there, I want to stop my share and ask Chanchal. So I just want to introduce you to Chanchal, and Chanchal had a few problems when I first spoke to her. She had registered for the 21-day health retreat in 2021, right?
21, yes,
21, in 2021. And then she told me she can't come because she's so sick. And she couldn't get out of bed. And I assured her that the 21-day health retreat was to get well. Right, Chanchal, do you remember all that? Would you like to tell them what were your issues and how did you overcome them?
Sure, doctor. Thank you so much for giving me this wonderful opportunity to share my experience. To begin with, I lost my father and my sister at early 50s because of hypertension. And with this, I had always this fear that, even I may end up in some cardiac related complications in my life. As I used to have repeated headaches, high palpitation, ringing in my ears, and migraine, and back issues also, and hyperacidity. And I was going on putting on weight as being a very stressful life in my early 35s and all. And being in a hardcore non-vegetarian family, our food used to be very heavy. And over a period of time, I realized that, I was very sensitive to outside food and junk food. So I started with yoga and meditation, and it really helped me a lot. And I also reduced my sugar and salt intake. And then I was thinking, okay, I'm leading a very healthy lifestyle. But one fine day, I really got a very strong attack of migraine where because of headache, severe headache, my BP shot up to 180 by 130. And I was forced to do all my blood tests. And then I was diagnosed with hypertension. And to add on to this, I also was detected with type 2 diabetes, where my HbA1c was 11.9. And then the treatment started with all the medications, BP medicines, 5 medicines for diabetes and 2 for cholesterol, number of health supplements and Ayurvedic stuff and all. But what my experience was that after taking all the treatment also, my condition was not improving to the mark, and it was more worse. And I was totally depressed and in total anxiety, because of the life sentence given to me, saying that I need to have medications lifelong. To find an alternative solution, there was a strong desire to cure and come out of this. And surfing on the net, I came across Dr. Nandita Shah's video, which said that how food can heal and reverse diseases. And I was so intrigued by this, I decided to go for SHARAN's 21 days residential retreat, wherein, under the expert guidance of Dr. Shah and daily monitoring of my blood pressure and blood glucose, my conditions were getting normalized, and slowly, my medicines were getting reduced. And on the last day, that was, I think, 20th day, I was free from all the medications, and I was feeling so much energetic and transformed. And there I got a practical experience how food is the best medicine. And my HbA1c since 1.5 years, and now it is like, 6, and it stays at 6. And in the initial 3 months only, I lost around 13 to 14 kgs. And I feel so much, happy. And I'm like, this has fueled my passion to work in this field. And I decided to join SHARAN as a facilitator. And thank you, Dr. Nandita Shah. I feel that I meant to do this work. And thank you so much, SHARAN India. Thank you so much. And I've never looked back.
Chanchal. Thank you, Chanchal, for sharing your story. And what is really important, you saw in Chanchal that the medicines were reduced as health improved. In fact, Chanchal was free of all her medicines within 21 days of the program. And you saw that within 3 months, she had lost 13 or 14 kilos and got rid of diabetes, hypertension, high cholesterol, and also the ill feeling. She had back problems at that time as well. Now, I want to share with you how to change this, like what will be the meal plan. And today, if we look, normal meal plan is something like this. Wake up, tea, coffee, biscuits. Then breakfast, poha, idli, dosa, upma, cereal, eggs, toast, sandwich, paratha, something like that. Then a snack could be tea, coffee, and biscuits. Then lunch could be chapati, sabzi, dal, rice, curds, buttermilk. Snack, fried namkeens. And dinner, again, chapati, sabzi, dal, rice, curds, buttermilk, pasta, soup, salad, pizza, whatever. Okay. Now, how are we going to convert this into healthy? Remember, we don't want tea and coffee. So in the morning, we could start the day with a herbal tea or water with lime juice. Lime juice is full of vitamin C if you squeeze it freshly and have it. If you leave it out, it oxidizes and then the vitamin C can be lost. But if you squeeze it freshly and have it in the morning, it's a great way to rehydrate. I have to say that tea and coffee dehydrate, herbal tea and water rehydrate. And that's very important because you haven't been drinking all night, maybe. Then breakfast, no matter how you cut it, we should have raw, the best food in the world, fruits and green smoothie. How to make a green smoothie, we've been having a lot of classes on this, and the recipe is also on our website. Then snack in the pre-lunch, only if you're hungry. Remember, usually green smoothie and fruit is filling, but if you're hungry, no harm. If you're having a snack, it could be brown rice poha, red rice and whole urad dal, idli, dosa. Recipes are on our website. Millet upma with lots of vegetables, chutney, muesli with a plant-based milk, a tofu scramble instead of eggs, stuffed parathas without oil, you can make the dough with potatoes and atta and make it really soft without any oil, or chillas or wraps instead of sandwiches. And if you're already in office, you could have just something light like a herbal tea and peanuts, or a herbal tea and muesli. And then lunch, instead of the buttermilk or curds, we'll have a salad. So salad and chapati or whole rice, sabzi and or dal. Isn't that simple? I mean, it's pretty simple to get healthy, and it's pretty tough to get healthy and free of medicines in the regular way, right? And then a snack in the evening, if you feel like something chatpata, it could be sprout chaat, aloo chaat, chole chaat, or it could even be, if you like something sweet, fruit and green smoothies, or we have plenty of dessert recipes on our website, and you can make laddus and brownies and have them at this time. And then dinner in the evening would be again something similar, like a salad, or chapatis, sabzi, dal, whole rice, whichever you like, or wraps or whole pasta. And we have more than 600 recipes on our website. So don't forget to look there. Now, if you're living abroad, then your meal plan might be a little different because it may be easier to make. So if you're having, the current meal plan could be something like this: tea, coffee, biscuits, cereal, porridge, eggs, toast, sandwich. Snack would be tea, coffee, biscuits. Lunch could be a soup and salad, or a sandwich, or a pasta, or a wrap, or a pizza, or a main course. A snack, fried snacks or crisps, and dinner could be a main course and a dessert. Now, one thing I want to tell you is, even if we want to lose weight or reduce fat, please don't diet. Because when we diet or try to reduce the food or try to be too strict on ourselves, then the hunger overtakes, and between meals, we're eating all kinds of things. Don't let that happen. So make sure that you eat only when you're hungry. And when you eat, make sure that you're satiated. Not overfull, but you feel satiated, right? So the new meal plan could be something like, again, herbal tea and water with lime juice in the morning, green smoothie and fruit, then muesli, if you need a snack, a muesli or a muesli bar, or a tofu scramble, or whole grain breads with a nut butter, or a hummus with bread, or wraps, or even just a muesli bar with herbal tea, or fruit. Fruit would be the best. And then lunch could be a soup and a salad, or a whole grain sandwich, or a whole grain pasta, or even leftovers from dinner, right? Or a wrap instead of a sandwich, because sometimes the bread, it's difficult to get bread which is totally whole grain, sometimes. And then a snack could be a fruit or a green smoothie or a muesli bar. And dinner would be a salad and a main course and a healthy dessert, or something like that. And remember, we've got lots of recipes on our website for all of these things. Now, time for health. And what's the solution? There is none. So here's a doctor saying, what fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? And this is not just a joke. It's really true that, not taking care of your health can lead to irreversible problems where you can't do anything. And, heart disease and stroke can be those. So how SHARAN can help, I'm going to tell you soon, or let me tell you now. We have a bunch of free talks like this, and this week we have several. We have a fabulous website with lots of information, and even more informative YouTube channel We send out informative newsletters all the time. We have a WhatsApp group which sends tips and all kinds of things that you can get in small bits. We have cooking classes, consultations, and even retreats. Now, you know, I've been doing this for a long time, so I know the results, but I do want to tell you about some pioneers in this field, both, and you might have heard of him, Dean Ornish and Caldwell Esselstyn started doing their research in 1990. Dean Ornish research for a year. He took a number of patients and made them follow this similar kind of lifestyle and got results and documented after a year of following up. Caldwell Esselstyn, on the other hand, followed up the patients long term. He had a fewer patients and he followed them up for 12 years. And then they both came out with these books, which are just amazing. And you can buy them in all bookstores or Amazon. And Dean Ornish came out early 1995 with his book, and Caldwell Esselstyn 2007 with his book. And these books are really amazing. And if you don't like to read a lot, I really recommend Caldwell Esselstyn's book because it's short and simple and easy to read and to the point. But Dean Ornish's book is also very good. So we at SHARAN are committed to building a culture of health. And for that, we have a team of doctors and nutritionists. And I'm going to stop my share now and bring in Dr. Aarti Rathi. And Dr. Aarti is in Vadodara and she's a clinical cardiologist. And clinical cardiologist means she doesn't do interventions or surgery, right? And she is also a certified lifestyle physician. Dr. Aarti, it's just wonderful to have you here. Dr. Aarti recently did our consultation training course, and she's already she knows everything already, but this is just about whole plant-based diet a little bit more. And now she's been consulting with our patients. So Dr. Aarti, what have you observed in this time? Would you like to share with them some of your observations?
Thank you, ma'am. Yes, definitely, because this is the right platform. Hypertension or high blood pressure is one of the most common lifestyle disorder I see routinely in my practice. Day by day, we see younger and younger patients suffering from higher blood pressure. What is alarming is that even after taking BP medications regularly, we need to upgrade the dose of medicines over a period of time. Not only that, even after taking BP medicines regularly, some of the patients land up with a heart attack, paralysis, or renal failure. So it makes us think whether these BP medicines actually treat the cause. More often than not, we realize that the cause of high blood pressure is faulty lifestyle. When I put my patients on a whole food, plant-based nutrition, along with lifestyle changes like optimal sleep, stress management, and graded exercise, I see that the blood pressure gets controlled well, and gradually I am able to taper off the medication. I have one young male patient who was morbidly obese. We were working on his weight, and we together started whole food plant-based nutrition along with lifestyle changes. We could help him reduce weight, and we could bring his BP medications from 8 tablets per day to 3 tablets per day. Not only that, when we saw his blood workup, we saw that not only his blood sugars improved, also his hemoglobin and his cholesterol workup improved. The patients also come back to us telling that they feel all the more energetic and positive in general. So the lifestyle changes, the whole food plant-based nutrition, sleep management, stress management, and exercise, this is the key to actually treating the cause of high blood pressure. Thank you, Sharan, for this opportunity.
Thank you, Dr. Aarti. And you know, Dr. Aarti is seeing patients at a younger and younger age, which is why this is so important. So I just want to tell you that though we have told you the important things and you can actually do it all on your own, what you do need help for is to reduce medicines. Or if your blood pressure is too high, until you get it under control, to put you on medicines. And that's where our consultations may come in. But otherwise, what you need is our cooking classes, our tips, our information, and our recipes to get healthy again. So these are the main things that I want to tell you today. I hope that by World Hypertension Day next year, none of you have anything close to hypertension. Reena, shall we take some questions now?
Yes, doctor. There are quite a few questions. So I'll start.
Yes.
Hema's asking, can peripheral neuropathy problem be reversed?
Yes, peripheral neuropathy can often be reversed, and I would say 99% of the cases. We often see this in cases of diabetes, and it requires, you know, all the things that we talked about today, including vitamin B12 supplements.
Dr. Naveen Kumar is asking, how about low blood pressure?
You know, it's very interesting that even if someone has low blood pressure, their blood pressure will get regularized and their symptoms of weakness, faintness, and other symptoms of low blood pressure will go away through a whole food plant-based diet.
Doctor, I think you have answered this, but if you want to add anything, Prashant is asking, how does healing happen? As in, how does cleansing happen to reverse this condition?
Okay, let me share a little bit more. You know that we saw in the image that plaque has collected in the arteries, making the artery narrower. How does healing happen? We make the blood thinner, the blood starts dissolving that plaque. When that plaque gets dissolved, because it's cholesterol, the cholesterol levels may rise in the blood. But that's not frightening because the blood pressure is going down because the arteries are widening because of releasing the fat in the arteries.
Dr. Yashodhara is saying, I've been a plant eater, but use yeast in roti. I found my blood test showed a very high B12, that is in the 900s. I find this strange.
Okay, Yashoda, I really doubt that it's because of the yeast in the roti, unless you're using some kind of nutritional yeast which has been fortified with B12. Because in the US, the nutritional yeast is fortified with B12. In Europe, it's not, so you can eat all the nutritional yeast you want, and you may not have normal B12 levels. So your B12 levels may be high because you were taking some multivitamins at some time or got some B12 injections. I just want to say that I know doctors who, before they treat the patient, they give vitamin B12 injections to see if the patient becomes better because so many people have this deficiency.
Dr. Amu is asking, what is an alternate to a morning beverage like coffee and tea? I feel so sluggish without it at least once in the morning.
Okay, so I just want to tell you that here you have myself, Reena, Chanchal, Madhura, and Dr. Aarti. And none of us, and maybe many others here also, and none of us take tea and coffee in the morning. Have you noticed that children we don't give them tea and coffee and they wake up bouncing and wake us up as well, right? So how come they are not losing energy in the morning and we are? So what should we do? We should stop the tea and coffee. Chanchal, no, she came for our 21-day program and tea and coffee is stopped on day 1. So she couldn't have tea and coffee. And she knows that no one suffered from the withdrawal symptoms of tea and coffee for more than 4 days. And the reason for that is the green smoothies. The green smoothies are highly alkaline and they you will be bursting with energy, but what it doesn't do is that it doesn't come in the way of your sleep at night. I know people who take tea and coffee only in the morning. And yet, when they stopped tea and coffee, their sleep was better at night. So I just want to tell you that it's so important, all these little points. We never want to give people more work than they need to do to get well. And all these little points are really important. So you won't worry about, you won't feel sluggish for more than 4 days. So just do it.
Dr. Neeta is asking what foods to eat to increase B12.
The best foods to eat to increase vitamin B12 are fermented foods like sauerkraut or fermented vegetables or kimchi or even natto. Natto is a fermented soybean product and so on. Idli dosa are fermented, and I live in South India and everyone has B12 deficiency here.